Thank you, Katie. Hello, everyone. I'm Latricia Boone, Vice President of the Equality of Opportunity Initiative here at the United States Chamber of Commerce. In just a moment, we'll be hearing from Congresswoman Lauren Underwood, who represents Illinois' 14th District. Representative Underwood has been a leading advocate for a stronger healthcare system, bringing awareness to issues related to maternal health. She is the first woman, the first person of color, and the first millennial to represent her community in Congress. She is also the youngest African-American woman to serve in the United States House of Representatives. She is a co-founder and co-chair of the Black Maternal Health Caucus. Prior to her election to Congress, she was a registered nurse. Congresswoman, thank you for taking the time to join us today.
Thank you so much, Latricia. I'm so glad to be with you.
I would just want to jump right in. And again, thank you. We are honored to have you and looking forward to this conversation. With your background working in healthcare, you bring a unique and authentic perspective to the issues that we're talking about today, and particularly to your policymaking role. Can you share more about why the issue of maternal health is so important and how communities of color, particularly Black women, are being impacted?
Well, we have had some longstanding health disparities in our country, but we've seen that, yes, maternal health is one where, Black birthing people are 3 to 4 times more likely to die from pregnancy-related complications than their white counterparts. This is a disparity that's been around my entire lifetime, and I'm 34 years old. And for every death, we have 70 near misses. And so when I think about the opportunity that we have to make a difference, when I think about the opportunity that we have to save lives, I think that in many respects, we're long overdue to take this action on maternal related deaths, particularly in communities of color, because the majority of these deaths are preventable. We know what the solutions are. We've just not necessarily seen the political will or the prioritization of this population when we think about policymaking circles. And so, this is really our opportunity to make a difference.
Yeah, thank you for stating that. And it's interesting, you talk about it being a long-standing issue and one that, thankfully, we have folks really on the front lines now trying to bring awareness, but also action to. As you think about this, why do you believe, I almost feel silly asking this, but I think it's important to frame for our audience that we as a country really need to make critical investments to improve health outcomes for all?
Well, we have to take action because things will not just change on their own. We have an opportunity to intervene. When I think about this disparity, it persists. So that means education status, where that would usually mean highly educated birthing people are less likely to die. That's not the case for Black birthing people. Having health insurance, getting prenatal care, right? Those things are not protective factors in the way that we might usually anticipate. And so this is not a problem where kind of like trickle down solutions are going to make a difference. We have to be specific, we have to be targeted, and we have to be aggressive if we are going to end this disparity. When we talk about maternal mortality or maternal deaths, because of this disparity that we see among Black women and Indigenous women, the United States leads the industrialized world in maternal mortality, right? So if we can solve this problem, we help improve healthcare and the health status for all birthing people. And I think that that's a very worthwhile goal. And certainly when we think about the investments that we make, they're shared outcomes.
Yeah, specific and targeted. I really love that because I do think that we talk about that in a business context so often, but even in the context of what we're talking about, our healthcare system, which at the end of the day, to your point, adds value in so many other areas of how we think of ourselves as a leader globally. Mm-hmm. So I really appreciate hearing that. As co-chair of the Black Maternal Health Caucus, you've really helped to spearhead the Black Maternal Health Momnibus Act 2021, which is focused on solutions that help to end our country's maternal health crisis. Can you talk a little bit more about this comprehensive package of bills and really what they aim to address specifically?
So the Black Maternal Health Momnibus Act is a comprehensive suite of bills. We have 12 bills aiming to end our nation's maternal mortality crisis. But what it doesn't do is that it's not duplicative. So for example, we've had some longstanding initiatives, bills that are attempting to expand postpartum Medicaid. That's not in the Momnibus. What the Momnibus is looking at are issues like social determinants of health, housing and transportation, nutrition, and how some key investments there can help save moms' lives. We have the Moms Matter Act, which is addressing mental health and substance use disorders, which are becoming a leading cause of maternal death in this country. We have a bill specifically aimed at helping our veteran moms. Why? Because the VA is a federally run healthcare system, and we have an opportunity to reduce the disparity that we see even within that healthcare system. We have legislation related to COVID-19, because we know the data has shown us in these last 15 months that we've been in this pandemic, that there's this dangerous combination of pregnancy and COVID, where, particularly women of color are more likely to get severe COVID. And when they do, they have really negative birth outcomes, right? And so we've taken those early experiences in the pandemic, crafted legislation to help give us the tools to increase maternal vaccinations, for example, and save lives in the pandemic context. The last one I'll spotlight is our climate change related bill. We know that extreme heat and air pollution will lead to a negative birth outcomes for both mom and baby. And so we have a bill specifically targeted to help increase the resources that folks would receive in order to be able to fight back. So we're trying to fill the gaps. We're looking at the data and the evidence, trying to make sure that we are data-driven policymakers, right? But also in a way that's inclusive and bipartisan so that we can save lives.
And you said a lot of things there that really just prompt me to think about our work in a deeper way. You talk about some of those intersections and the fact that there's so many ways or things that are impacting that aren't just isolated to health.
That's right.
When you think about, the various partners and key stakeholders that you've been working with to bring awareness to these issues and really help advance those policy solutions that are part of this package of bills, can you share more about how you've engaged the business community this far and where you might see greater opportunities for a business to lean in from a partnership perspective, whether it's a company that's in the health industry or companies that are just looking at this from the perspective of an employer?
We've been really pleased to be able to partner so closely with industry leaders. And when I say we, I mean the Black Maternal Health Caucus that I co-chair. We've consulted with key private sector stakeholders in drafting this Momnibus bill, the comprehensive suite of legislation. And so it's really led to the largest and most diverse coalition of endorsing legislation of legislation of this kind, right? So when we look at the groups and the companies that have engaged, we've not seen this kind of cross-sector come together before on a healthcare bill like this. We've collaborated with the Blue Cross and Blue Shield Association to get their real-time data on maternal health outcomes. And that lets us inform evidence-based policy solutions. That's really important because the federal data is often lagging maybe 3 to 4 years behind. And so when we can work with like issuers, for example, private insurance companies, and they help us out, we're able to get a more real-time snapshot, which has been really important, for example, in the COVID context. We've worked with AHIP, America's Health Insurance Plans, the Federation of American Hospitals, and other healthcare industry leaders to push for the expansion of the postpartum Medicaid coverage expansion. And then we've been engaging in these really robust conversations with companies that have been looking to leverage their own expertise and utilizing their own services in order to address maternal health disparities. So I'm thinking about rideshare companies like Uber and Lyft that want to make sure that new moms can get to their postpartum visits. The diaper companies like Huggies, who want to make sure that pregnant people have the essentials that they need to care for their growing families. And, one of my favorite things about our Black Maternal Health Caucus is that we've really served as a maternal health hub, right? We're connecting the private sector companies that are looking to support this cause with local organizations. And so then they're able to foster these partnerships that expand the reach of those organizations and lead to really critical initiatives that save moms in their communities across the country. Now, those are a few examples that are both directly within and outside of the healthcare space, but it's, I think, a good snapshot of the leadership, the bold leadership that's being displayed that enables us to have these kind of comprehensive solutions advance within the Congress. And it's those partnerships and these solutions that will be needed to end this crisis.
Yeah, that's powerful. And I think to your point, the partnerships and the bold leadership and the innovation that you just shared with us, those examples are really how you make progress and move things forward. And to that end, I mean, you've achieved a significant milestone with the bill in June when the House Energy and Commerce Subcommittee Subcommittee on Health announced its consideration of 2 additional bills included in the Momnibus Act. Can you tell us more about that and how you anticipate this legislative process moving forward?
Well, we're really excited that the Momnibus has so much momentum both in the House and in the Senate, but you're absolutely right. Energy and Commerce advanced the Maternal Vaccination Act, which is led by Congresswoman Terry Sewell, and it just passed the Energy and Commerce Committee, the full committee, with unanimous bipartisan support. And then we had the Data to Save Moms Act, which is led by Congresswoman Sharice Davids. And that also passed the Healthcare Subcommittee with unanimous bipartisan support. We have the Social Determinants for Moms Act, led by Congresswoman Lucy McBath, that EMC just considered in a legislative hearing on their Healthcare Subcommittee. And so, listen, we are leaning in. We are trying to move these bills individually through the committee process while also looking for opportunities to advance the entire Momnibus as a whole. We know that we cannot solve this crisis without a comprehensive approach that the full Momnibus represents, but we also respect regular order in the Congress. And so we sort of have a both and strategy going on.
Yeah, that's great. That is awesome. Coming back a little bit to the U.S. Chamber of Commerce and the work that we're doing here, our Equality of Opportunity initiative is really focused on advancing private sector solutions and best practices, in addition to policy action and some of what you just talked about as it relates to closing race-based opportunity gaps. Given the broad scope of the Momnibus Act, what do you see as the larger role of the business community in addressing maternal health and improving health outcomes in meaningful ways? You shared some examples earlier of ways that folks are leaning in and you're partnering, but as we're talking or hearing from our larger group and our larger network, just share a little bit more about ways that you see our member companies and others that are engaging with the U.S. Chamber really leaning in to support this work.
Well, as we've seen with the pandemic, public health crises, whether it's COVID-19 or maternal mortality, they require not only a whole of government response, but really a whole society response. And that's what the Momnibus would provide. One section of our Momnibus would establish an interagency task force with representatives from federal agencies and community-based nonprofits and private industry to develop comprehensive strategies to address social determinants of health during and after pregnancy. And so in addition to including these industry partners on the task force, this interagency task force, the Momnibus also provides opportunities for the private sector to engage in the development of a perinatal care alternative payment model demonstration project. It has opportunities to identify hospitals that are interested in establishing respectful maternity care compliance programs. And those are important because they allow us to collect better data on the prevalence of bias and discrimination and racism in maternity care. And it really just fosters accountability, which is something that in many ways we can improve on. And then it also industry can help us develop and to disseminate digital tools to improve maternal health outcomes in underserved areas. There are so many opportunities for employers to lead on the issue of maternal health outside the context of the Momnibus or any other federal legislation too, right? Like everything is not, going to be dictated in the text of a bill, right? And so we encourage companies to think about leveraging their own data to provide the government and researchers and the public with more comprehensive and timely understanding of the maternal health outcomes across the country. Companies can look for opportunity to bring their own products and services to pregnant people and new moms. They can partner with and support community-based maternal health organizations within their own area to ensure that their neighbors, right, have the resources that they need to carry out the important work with and for pregnant people. And then I would also just encourage companies to continue to advocate for policies like the Black Maternal Health Momnibus Act, both in public settings like we're doing today, but also in conversations they're having individually with lawmakers. Because together we can take the bold action that will be required in order to save moms' lives, end these racial and ethnic health disparities and maternal health outcomes, and achieve true equity and justice for all.
Yeah, thank you so much, Congresswoman Lauren Underwood. I think, the things that you just lifted up are the things that we are very proud of at the U.S. Chamber of Commerce in terms of how companies have been able to, even during our global pandemic and COVID-19 and everything we've been dealing with, been able to step up, lean in, support community, bring innovation, use data, all of these things that we know we have an opportunity to lead and unite around have happened. And so really appreciate the opportunity to hear more from you about this. I'm excited for us to move into the next part of our conversation. But again, thank you so much. And we are looking forward to our esteemed panel to dig in just a bit deeper on some of those disparities we just talked about and how we can be solutions driven in this work. Thank you.